patient with skin traction. First, we will do the neurovascular assessment. How to check the neurovascular status of a patient with skin traction. Okay, so our patient here has left femoral fracture, so he has this skin traction. So we will do the neurovascular assessment. First is to ask or to assess for the pain. So how do we know that the patient is in pain? We have to look into the facial grimace of the patient. Of course, he will verbalize that he is experiencing pain. So it's not normal that the patient is or will experience pain after the skin traction has been applied. Second, we have to check for the pulse, okay? So you have to palpate the pedal pulse, okay, and then compare it with the unaffected extremity. So if this is decreased, okay, as you compare it with the unaffected extremity, then there is something wrong with the affected extremity, with the cast. Another parameter also is to check for anesthesia, okay? So you have to ask the patient if he has this numbness or tingling sensation or pin or needle sensation. So the patient will verbalize that he has this numbness. Another parameter would be the movement or mobility. So you have to ask the patient to move his toes. So he should be able to move the toes. So if there is a problem after you have attached the skin traction, maybe there is nerve damage, and you will not be able to move the toes. And the last parameter that we will be looking at is the temperature also. So you have to palpate and touch, okay, the skin. Is it cold to touch or is it warm to touch? Compare it also to the other extremity. We also need to hook or attach the patient to a pulse oximeter if we will not be able to palpate the pedal pulse, so as we will be able to assess the pulse of the affected extremity. Okay, so after we have done with this parameters, checked with the patient with this skin traction, we will document, okay, our findings and report that immediately. Now, we notice that the patient with traction, we should make sure that the weight should be hanging freely. Okay, so we are generally, we should make sure that the weight should not touch the frame. It should not also touch the floor. So this is basically the principle that we should be watching. Okay, and also the traction should be parallel. It should be straight with the affected extremity, with the body, and of course with the trunk and the head. So we should make sure that the patient is aligned with the traction. Okay. So that would be all for the care of patient with skin traction.